And we are back. Hormonal imbalances can be a challenging and frustrating experience for younger women. Statistics show approximately 80% of women suffer from hormonal imbalances. And sharing now more information, we got the owner of Washington Heights Wellness, Dr. Rosanna De La Cruz, and we welcome you to the show. And I got to say, on a personal note, we've been doing this for a minute, right?
Yes,
and
yes,
we've been
we have.
talking. Most of the time, it's been through Zoom and COVID. Now we got an opportunity to have you in the studio.
Thank you.
Thank you for holding us down, honestly, during COVID, and glad to have you here.
Thank you for having me. It's a pleasure and an honor.
Honor too. So listen, we want to talk about, this is Women's History Month, and as we talk about women's health, hormonal imbalance is really huge.
Yes.
And it affects a lot of people. How big is hormonal imbalance in the lives of women?
It's pretty, it's a big factor on our quality of life and our day-to-day activity of living. It's often undiagnosed when we have disease for a very long time. And when the hormones are imbalanced, then it's not a disease. So for the medical field, it's not as important. Oftentimes women are told, oh, it's just a hormonal imbalance, and they do the test. And the tests are within the scales, but the women don't feel well. There are a lot of symptoms that can continue to happen, and they don't look like hormonal imbalances because we're not aware of what that looks like.
And I'm glad you said it, because I want to get there, right? Because we want to talk about these symptoms. What are some of the symptoms that maybe we're not so familiar with, that we just pass off as regular?
Yes. So there are two systems in our body they're basically twins. It's the nervous system and also the hormonal system. So we cannot have a hormonal imbalance and then have a perfect nervous system working. So one is going to affect the other. And both of those systems are affected by the gut, because we die if we don't eat. So therefore, everything that has to do with our function, bodily function, will affect the gut. So some of the things that you will notice when it comes to hormonal imbalance and affecting the nervous system is going to be insomnia. And insomnia can be very different for everyone. It could be inability to fall asleep or stay asleep, or both, or just going all night without sleeping. Gut issues such as GERD, acid reflux, constipation, or loose stools. I know that's a little invasive to talk about, but it's very real to all of us. As well as some high levels of stress that can cause a constant worry about things that we might think that something very bad is going to happen, when in fact it's a hormonal imbalance. And then we can also have joint pain without a reason. There is a very interesting frozen shoulder syndrome for women who are either perimenopausal or menopausal. And this frozen shoulder can sometimes be suggested that we get a surgery, when in fact it's high levels of inflammation in the body due to hormonal imbalances.
So I'm going to cut you off. Stop me here on the frozen shoulder piece, because I need to know more about that. What's that?
Yes. So frozen shoulder is inability to move our shoulders, because it feels literally frozen. It's very painful. We cannot sleep on that side. There could be numbness and tingling and pain. So it is one of the most strange symptoms that we can have with hormonal imbalances. And oftentimes we just think it's something very physical, meaning that there is a rotator tear there, or it could be a nerve, and it could just be high levels of inflammation accumulating on that joint, as well as other joints in the body like knee, neck, any pain. Again, any hormonal imbalances can cause a nervous system imbalance, and vice versa. So it goes undiagnosed because our bodies are telling us things differently. For everyone experiences life differently.
Right. We also know that when it comes to hormonal imbalance, there's a lot of myths out there. One of the things that people have done is they've taken it actually and made it a disease. And we know that there's a difference between disease and hormonal imbalance, but I would love for you to clarify, because hormonal imbalance is not a disease.
Correct. It can feel like a disease because if we're not sleeping, if we're in pain, if we don't know what's happening with us, we are in a state of subhealth, which means it's not optimal. And that is not considered, it's not considered a disease. However, there are diseases that can be hormonal based, such as diabetes is a hormonal imbalance. Starts with hormonal imbalance, like not being able to process insulin or sugars as we should. in our bodies, or it could be a thyroid condition that can start with unexplained weight gain. And so the imbalance can lead to a disease, but not all imbalances are diseases.
Yeah.
So there are a lot of diseases that we experience, especially here in New York and in America in general, due to high stress levels that can trigger a hormonal response that can later lead to a disease. So it's better to address the imbalances before they become a disease. And also, it's good to feel good in our bodies and not be in a state of subhealth when we don't feel well, but we're not sick.
Right. So I know, and I'm not being sexist, please don't email me, don't do anything like that. I mean, I'll take it, but don't email me. I understand the context of the question. There's a lot of men out there that are asking the question, will we, have ladies in our lives, and we've got family members who are in our lives, they've got to deal with this issue of like the emotional.
Yes.
Right? And the emotional becomes something that everybody has to deal with, not just the spouse, but you got the children who are dealing with it, you got coworkers who are dealing with it. What are the signs or the symptoms, if you will, of emotional hormonal imbalance? We hear people give it out the argument, oh, it's a hormonal imbalance, right? But the reality is what are some real signs and symptoms?
I want to say also that men experience hormonal imbalances too. It's just that women have different cycles,
right.
So therefore it's more noticeable sometimes. And in the same way, yes, there are some imbalances that can cause severe emotional turmoil for women who go through a cycle throughout the month. So if you see that a woman is almost like 2 weeks out of the month is experiencing severe emotional distress, then definitely is progressing. The imbalance is progressing. It could be due to pain. It can also be due to stress, due to the imbalance. And that can cause emotional turmoil or discomfort. And yes, the person next to us is the first one who suffers. However, a great way is to just be able to support that person, whether it's through a hormonal imbalance or a difficult time that we are going through. That's the first thing we want, someone who can hold a space for us without having a solution. And then also recommending to get help, because there is help. It's just sometimes we don't know because it's not a disease. So we go to the doctor, well, everything is okay in your blood test, so you must be okay. Go home and continue to deal with not feeling well.
Right. We talked a little about the emotional symptoms, but talk to me about also the mental side, because there are some mental symptoms that are associated with hormonal imbalance.
A lot of times, especially women, because we're always thinking, we are thinking, we overthink a lot. And so that's something that can be definitely more present during a hormonal imbalance, where we're progressing through our lives, things are changing, we have bigger responsibilities as we go through life, our children, or if you don't have children, work. So the mental aspect is just really, it's very important to be able to connect with our bodies, but also to be able to hold that space for ourselves. So an example of this is if you know that you're having either mental, emotional imbalances or difficulties, it's important to stop and look and see what we need. And sometimes just ask ourselves, what do I need right now? And whatever is good for us that comes up, take a small action to take on that thing that we need, that our body is needing or our mind is needing.
And typical age that you usually see hormonal imbalances start to kick in?
So we treat patients as young as 13 with hormonal imbalances in our clinic, and it could be a PCOS, which is polycystic ovary syndrome. It's very common. It's now being more of the upfront of medicine. There are no solutions for polycystic ovary syndrome, but it can start as early as the first period. And then from there, the most difficult part is the beginning, and also just when we are trending toward the perimenopause to menopause stage, which is, it can start at 35. So basically, there is no age. Once we start our cycles, we can see, there is a higher rate of infertility now as well, or difficulty conceiving. Sometimes it can be due to a disorder, and sometimes can be unexplainable. And they all associated with hormonal imbalances, and also some conditions that the imbalance leads to.
Since the last time we met, things have happened for you. I mean,
yes,
you've opened up a second location?
Yes, we have. We are here in the Bronx.
Okay.
We're in Riverdale, and that's also a very great community, because sometimes we had patients coming from the Bronx, from further away. It would take them about an hour in the bus. It's closer in car and driving, but it's not that easy to drive to Washington Heights and get a parking. So we opened a second location in Riverdale, and it's going great. We have a great team of employees and myself supporting that community as well and supporting the Bronx.
Well, we're glad to have you here. So
Thank you.
Dr. Rosanna De La Cruz, thank you so much for being with us. Good to see you in person.
Good to see you
right?
too,
Then you
yes.
got Washington Heights, now we got Riverdale. We got to have you back, so now you know how to get here. So
Yes.
it's right around the corner. So
I do.
Thank
I
you.
do.
All
Thank
righty.
you,
Well,
too.
listen, if you want more information, please go ahead and visit the website at acupuncturelocal.com. We encourage you, don't go anywhere. We do have more open coming up, and we'll be right back right after this.